Are you worried that you may be suffering from social anxiety? Well, tune in to find out more. Dr. Martin here, and welcome to another Martin Minute, where I fit in a wealth of mental health information in 5 minutes or less. Today, I am talking about social anxiety. Now, many people, when they think of social anxiety, they think it's just about being anxious around individuals, which is true, but that's actually only one part of it. Social anxiety also involves fear of negatively being evaluated, fear of being judged, having anxiety about being rejected within the social setting. So it's not only about being nervous or experiencing fear at the thought of social encounters, it's also about having concern about being scrutinized, scrutiny that may be encountered. And as a result, there's a conscious effort to avoid these social encounters. And because of this effort to avoid it, it can negatively impact your work or your school or your home life. Or when the social encounters can't be avoided overall, they are endured with intense fear and agony and anxiety. Now, when it comes to social anxiety, it can also be combined with physical symptoms like increased heart rate, sweating, dizziness, fear. And these symptoms typically last for 6 months or more. They would be persistent to be diagnosed. When you think about social anxiety in children, you need to think about different ways it may manifest, like crying, tantrums, freezing, being clingy, or also refusing to speak in social situations. Now, when it comes to treatment for social anxiety, that can involve medication, it can involve therapy, or combination of the two. One of the first things you need to do is educate yourself about the symptoms so you can truly know when to recognize them in yourself and in others so that you can provide support. It can also be really helpful to identify like the thoughts of the fears that you're having regarding the social encounters. What are you concerned about being scrutinized about? Is it about like your tone? Are you afraid that you may say something that may be perceived as stupid? Are you afraid of being judged based off of the way you look and people are staring at you? Things of that nature. Now, you can do that by journaling and processing it out that way. And you can also do it by just having a conversation with someone, a mental health professional, or another form of a support system. Also, relaxation strategies can be incredibly helpful when it comes to having concerns regarding social situations that cannot be avoided, because it's not always the case that they can be avoided. Breathing exercises, progressive muscle relaxation. That is when you tense and relax certain aspects of your body with your like arms. Well, these are hands, arms, shoulders, and really focusing on the tensing and the not tensing of the muscles. You can also try to talk yourself through the situation overall and do other grounding exercises. But if you are experiencing these symptoms repeatedly and you have to avoid them, it's likely would be beneficial for you to seek professional help so that you don't have to endure this alone, because you're not alone. Social anxiety is actually very common. A lot of people get it mixed up, but the hallmarks are always going to be fear of being around individuals in social situations, avoidance of those social situations as a result, having intense symptoms when you can't avoid them, as well as just having a concern regarding being judged or scrutinized in those environments. It's not just you not liking people, it's a fear of being in an environment with a bunch of people and being judged and not being able to process that, and it negatively impacting you overall. So thanks for checking in for this Martin Minute. I hope this provided you with some helpful information. Please realize that it always starts with education, because with education, you know when to recognize it in yourself and others, and you can act accordingly. Please feel free to comment below if you learned something new. Please comment below if there's something else you want me to discuss when it comes to symptoms overall. I was actually thinking of breaking down every single diagnosis in the DSM, but that did seem like a lot. And then follow, like, subscribe to all my platforms: TikTok, Instagram, Facebook, and of course, YouTube at Raquel Martin, PhD. Thank you so much for joining me. Please remember to be kind to yourself.